Hi, my name is Brett Owens. Today we're going to be showing a technique of using CartiMax to treat an articular cartilage defect of the patella. CartiMax is unique because it has viable chondrocytes, but it's also moldable to fit articular cartilage defects that have challenging geometry. We have a right knee. We're going to be making a medial parapatellar arthrotomy. We're going to start off by just drawing some of our simple anatomy. Distal pole of the patella. We'll kind of sketch out the inferior portion of the patella. And we're going to basically be coming right along our medial border of the patellar tendon and make our arthrotomy just adjacent to that. We're going to be extending it up a little bit as well. Our medial joint line, medial femoral condo. So we extended our arthrotomy slightly in order to evert our patella and address a patellar articular cartilage defect as well. Here you can see a fairly sizable defect, full thickness, already prepared with fairly vertical shoulders. This is 18 millimeters in the superior inferior dimension. Medial laterally it's around 12 millimeters. So a fairly sizable defect in the central portion of the patella. All right, so now we're going to prepare our CartiMax. What we have is our vial containing our live fibers in solution, already thawed. We have our CAM, our cartilage allograft matrix. We have a bowl, a spatula, our straining cap, and some normal saline, and a syringe for the normal saline. All right, so we're going to start by removing the cap from the vial containing the live fibers. We're going to put our straining cap on. We're going to drain out the solution. A lot of these live fibers like to stick to this straining cap, so we're just going to make sure that they're back down in our vial. We're then going to rinse these fibers. So between 10 and 15 cc's of normal saline, usually 2/3 fills that vial. We put our straining cap back on. We're then going to shake it up a little bit, ensure that we adequately rinse the fibers. And then we're going to pour out the excess saline in our bowl. This point is important. Make sure that you get the excess saline out from amongst the fibers. Again, the fibers want to stick to the cap. We're just going to bang them back down into the vial. At this point, we're going to open up our CAM, or our cartilage allograft matrix. We're then going to put the CAM in amongst our live fibers. And then we mix. We take our spatula. We begin mixing the solution together. The combination of the CAM and the live viable fibers are going to make somewhat of a putty. Once you have the consistency of a putty, you know your mixing is complete. Again, it's very important at this point to ensure you adequately dry the base of the lesion. We then have our CartiMax ready for implantation. We're going to see how we can fill the lesion. This is a thicker lesion, it being patella articular cartilage. We're able to just about fill that defect. If you want to add more, you certainly can, and it will mold right into position. And that's just about flush with the rest of the articular cartilage. And that's our finished product. At this point, I usually do not need any fibrin glue. I've already irrigated the knee joint. I also would not add any irrigation. I would begin by closing our arthrotomy.